Variability in healthcare is a big global concern. Research shows that different doctors often treat the same condition differently. The result is poor clinical outcomes and high expenses. The key is to reducing this variability is by harmonizing clinical decision-making. UpToDate is helping 4 leading institutions in Mangalore achieve precisely this objective. UpToDate is helping these institutions with clinical decision support at the point of care. This gives the entire care team access to the information needed to make evidence-based decisions for their patients. By sharing and applying the same clinical standards across the continuum of care, hospitals can reduce care variation, manage costs, and improve outcomes. KMC Mangalore was the first to introduce UpToDate in its hospital to its clinical workflow. Then, Father Mueller and KS Hegde adopted UpToDate. And finally, Yenopaya Hospital brought it on board for their doctors and students. From the moment a hospital subscribes to UpToDate, Wolters Kluwer trains clinicians on how to use it to their best benefit. The training helps hospitals to follow protocols, guidelines, and graded recommendations. Students rely on UpToDate to make confident diagnosis and treatment decisions, and also for exam preparation. See what Librarian Suprita Shetty from KS Hegde and Mamta Pramod Kumar from Yenopaya Hospital have to say about UpToDate. What is the best thing you like about UpToDate?
Healthcare services are undergoing transition with more emphasis on quality of care, patient care and safety. There is an increasing expectation that practice should be supported by current evidence. We as health science librarians play an essential role in supporting evidence-based medical practice. So we should see that our libraries provide point-of-care tools and also synthesized resources like UpToDate, which we have subscribed. This is an essential requirement for any doctor.
How does your teaching hospital benefit from having UpToDate?
Clinicians have themselves requested for subscription to this clinical evidence-based resource called UpToDate, and that they would benefit from the use of this. They have been asking for this resource for the last 2-3 years, and finally we were able to get subscription for this database last year. It has surely benefited them because they are all using it on a day-to-day basis in our hospital.
How often do you use UpToDate in your hospital?
I have spoken to many of our clinicians here. What they say is they are using it on a daily basis, and it is very useful for the students also during rounds and also for their postgraduate studies. They use it on a day-to-day basis for all their studies as well as for management of their cases.
What is the best thing you like about UpToDate?
Very handy and accessible. It is there available on their on their mobiles. So it is there at the click of a button at their fingertips. So the main thing is access. They are able to access very easily. So even during their rounds or when at the bedside, it is very handy for them to use this particular database, this resource.
What are the advantages of using UpToDate compared to other clinical decision sources?
It is very useful to them because they are able to access and all the logarithmic values, the reference ranges, and the standard guidelines are available in UpToDate. So on the spot updating of clinical knowledge, that is what they say. They are able to update their clinical knowledge on the spot. So it's because it's so handy and very easily accessible.
Would you recommend UpToDate to other physicians or other hospitals?
Most of my colleagues here in the neighboring colleges are having subscription to this UpToDate. Whoever asks me, I would strongly recommend UpToDate to all my colleagues here.
Medical colleges play an important role in providing advanced medical care and in shaping the doctors of tomorrow. They, in turn, turn to UpToDate for support. UpToDate is used by over 1.7 million doctors worldwide and 37,800 medical institutions and hospitals. Trusted by the top 10 medical institutions in India, it has more than 25 specialties comprehensively covered, authored and peer-reviewed by more than 6,900 physicians. UpToDate can be accessed 24/7 via browser or app, anywhere and on any device. UpToDate is the only evidence-based clinical decision support resource associated with improved outcomes, and it has become an essential part of the everyday practice of medicine around the world.